So I'd like to welcome all of you to uh, this next session of DFoot International's DFoot Awareness Week, which is being organized every day of the week. Yesterday we had the North American Caribbean region. The day before that we had the Central American, South America. And tomorrow we're going to have the Middle East and North Africa. The first day we had Africa, Sub-Saharan Africa. And today we have Europe. And we have some recorded talks, plus we have a live talk by Dr. Roberto Ancini from Italy. And before I ask Dr. Roberto to speak, I think the purpose of this weekly program, Diabetic Foot Awareness Week, which we started last year, was to bring all the regions together. This is an opportunity for all the regions to integrate and be in one forum. So that is the purpose. That was the purpose with which we started this DFoot Awareness Week by DFoot International last year. And we allocate one day for each region. And on the 14th of November, we have all the regions taking part on a single day. So the program is already posted in our website, www.d-foot.org, and you can also register yourself. So I would like to invite all of you to register for the 14th November, which is at 1 p.m. GMT time. Now, today we have Dr. Abbas from Dar es Salaam, who's the president-elect, who is along with me to co-chair this session, and along with Dr. Miriam Botros, who's the CEO of Wounds Canada, who's also there along with me to co-chair this session from Europe. Europe is a very important area because our office is based in Belgium. DFoot International is based in Belgium from the time of inception. And it is a very important area for us. So, and we are fortunate to have Dr. Roberto Ancini, who's the regional chair for Europe for our organization, here this evening to talk to us. And I would like to thank all of you who have joined today to listen to Dr. Roberto and the other speakers in a recorded talk. I'd like to thank all of you. And with this introduction, I will ask Dr. Abbas to say a few words, and then Dr. Miriam, and then we'll ask Dr. Roberto to start. Abbas. Unmute yourself, Abbas. Unmute yourself. Yeah.
You are all welcome to this
Abbas, you can switch off your video. Your internet is not. Abbas, you can switch off your. Abbas, you can switch off your video. Dr. Miriam, can you just start, and then I'll ask. Okay. You can go ahead. Yeah.
Thank you, BJ. Hello, everyone. Welcome to the European Awareness Day. It is a great privilege to welcome all of you. to this important meeting. And certainly at DFOOT, we have a global vision where we can all, as a global community, continue to work together to raise awareness about the prevention and management of diabetic foot complications. And we are committed as a group and as a global body to end preventable diabetes-related amputations. Thank you for the great work that you're doing, and we will continue our work moving forward to make this happen in a reality. Thank you.
I think in interest of time, Dr. Roberto, would you like to go?
Okay,
Start
I
your
don't
slide
know.
share.
Yes, if you start with the recorded and
It's being recorded. It's being
yes,
recorded. So you can go, you can
okay,
start.
I share my slides, and okay, it's a very pleasure for me to stay today here. We recorded yesterday a section, but for me it's really important to speak about my opinion of this period. We know that Europe is a continent where generally healthcare for DFOOT is really important, is really efficacious, is really of high level. Okay, but we have, especially in this period with the COVID, a very dishomogeneous aspect. So if Vijay is correct, we can go with the record, and I share my slide. Okay.
Yeah. You can share it now. Yeah.
You are ready for a record, please, or not?
It's being recorded, so you can go ahead, Dr. Roberto.
I can go?
Yeah, you can go ahead.
Okay, no record section. Okay, my role today will be to take stock about a diabetes foot healthcare in Europe. The title of my talk is Diabetes Foot in Europe. And there may be a question, is a new era, or we need to speak about the awareness of a new era in this period? As you can see, in every part of the world, in every part of my country, in this day, we put together the problem of DFOOT and a problem of COVID. Last week, we have a big section in our National Congress to DFOOT with a lot of young professionists, and because the problem of awareness is a really problem in this period with a so difficult situation about the pandemic. I want to introduce what in Europe we did until last year's. In 24th of February of the last years, as you can see, 10 days before the lockdown in Europe, we took place a first meeting in Europe of some representatives of different regions of Europe, as you can see the name and the place, and with our past president, Lazaro Luis, and Norina Galvan. In this meeting, we discuss how, even if we have a high level of take care of patients with diabetes foot in Europe, we have some topics that is very different in different parts of Europe. Sometimes we have a poor real awareness of the impact of food in Europe. We have a difference in different countries, we have different use of resources, and then we have a different approach to diabetes food. Sometimes we have an uneven awareness of concept of prevention of unnecessary amputation. Sometimes we know that amputation is the first approach for a cost effectiveness for safe limb, because we know that an organization of multidisciplinary health is maybe that is in the first moment is more cost in comparison with a primary endpoint amputation. And then sometimes we have the inability to move from the now shared concept of a multidisciplinary, multi-professional approach to a real daily and practical implementation of integration of our job. During that meeting, we discussed about the future in that period, and we discuss about top priority in our work. We need a audit in Europe for a registry of diabetes and diabetes food in Europe, develop a specific code to understand a real impact in healthcare system of diabetes food, and monitoring how many existing food was in Europe, and then before the COVID, the importance of to look for new technology to improve our awareness or our control in the patient with diabetes, the diabetes food. And then we finish our organization with three important ideas, three important actions in that period for the coming months. Three aspects. We need to expand the knowledge of the food organization in Europe, the Food International Organization in Europe, and to develop a homogeneous way to do all together. Then we need a national organization of a multidisciplinary, multi-professional pathway in every part of our country. And then the third important level, to improve the knowledge and the awareness of the government, our stakeholder, to understand what means diabetes food, what are the impact on the society, on the healthcare system. There is, briefly, I explain you what we do 1 year ago, but as you know, 10th of March, we have in Europe the lockdown for COVID. So in this moment, taking care of patient, our outpatient, a patient with diabetes food, in 1 day changed completely. And all patients unit, outpatient unit was closed. For diabetes food patients, only an acute situation in the hospital. So change our way to do. We have very clear what means pandemic. Was and is and will be a tsunami for healthcare system, for a person that stay home, and we needed a rethinking healthcare for our chronic patients, and we need to in this rethinking to look for maybe a digital revolution or our way to keep in touch with our patients. In every part of the world has been published many papers that describe the difficulty of that period, the problem, a acute problem, how take care of patients with vascular disease or with osteomyelitis and so on. We know this aspect, but the problem is that many people, but in us remain a fear and dismay for a final outcome, because we need to prevent unnecessary amputation, because we need to reduce morbidity and mortality linked to ulcer and diabetic foot. Now we have, as you can see in this slide, we have a different period in COVID period. And now we have another problem that as diabetologists, as patient, as a profession that look for D-foot, we have to consider it. First of all, in this moment, we have a patients with diabetes mellitus and diabetes foot that lost their contact with diabetes foot unit. Is the first problem, and we need to retake care of this patient. The second problem, in the patient with diabetes mellitus that previously affected COVID-19, maybe that we must consider the possibility of a new class, of new risk class for these patients. And third, in general population affected by COVID-19, treated with the potentially hyperglycemic drug and who discovered diabetes, a new class of risk of our patients, especially when these patients have a multidisciplinary and a complication of diabetes. So we need of a new era of awareness of diabetes and diabetes foot. And we need to understand how to improve our organization imposed by pandemic, and what kind of upgrade of our diagnostic and therapeutic pathway that in every country, in every nation of Europe are present, but how we can update it. One proposal may be that we need to consider it, maybe, a patient affected by COVID-19 to introduce the aspect in our ulcerative risk category, because aggravating risk at every level we need to implement our monitoring. Remember a vascular aspect of COVID-19, that is so important for developing a diabetes foot in future. Here is our mission. Of course, always in Europe, a multidisciplinary, multi-professional approach, patient-centered. We have the sufficient skill in Europe, knowledge, behavior, to prevent the foot, to improve our outcome and reduce our mortality and morbidity. And I want to conclude with two aspects. We know the impact of COVID. We know how COVID is linked with the mortality and morbidity in diabetes, and in diabetes with the more comorbidity. And diabetic foot, the syndrome of diabetic foot is one of these, and that we have in Europe the hand. We have in Europe different healthcare organizations, different approach on diabetic foot, and we need to adapt this organization to a new situation. And I think that we don't want to run the risk that our certainties, our way to do turn out to be just a dream book. Thank you for your attention, and I like to listen to the other colleagues. Thank you.
Thank you, Roberto. You can switch off your slide screen. Yeah. So I think we will have some discussion after two more talks. So if you can just wait for 10 minutes more, we will have two more talks, which are recorded, and then we will have some discussion. We will now hear a talk by Jaap van Netten from Netherlands, who is the coordinator for the IWGDF guidelines. The IWGDF guidelines originated from Europe, and IWGDF and DFOOT were two arms of the one organization. The IWGDF was the guidance arm, which writes the guidance, the guidelines, and DFOOT International was the organization which was supposed to implement them across the globe. So we have Dr. Jaap van Netten's recorded talk, and we will now listen to what he has to say.
Hello, everyone. Thanks, Norina and Fran, for this invite to have me chat a few minutes about what I think about diabetic foot disease and the awareness. And congratulations on DFOOT International for putting off this Diabetic Foot Awareness Week, which I think is really important. My name is Jaap van Netten. I'm a human movement scientist from the Netherlands and is doing research as well as working in clinical practice on preventing foot ulcers in people with diabetes. Norina asked me a few questions and I'll read them and give my answers. So the question is, do you think we have enough awareness of the impact of diabetic foot disease on health services and our patients? And I'm afraid the answer is still no. We've come a long way. We're doing much better, but very often we still see that it's the neglected part. We don't really look at the feet until it's too late, but we're not really focusing all our energy that is equal to the burden that foot disease is. So we have an enormous gain still there if we create more awareness and if we make people more aware of the devastating consequences of diabetic foot disease and how good it can be prevented. So what has been the biggest advance in the management of diabetic foot in your career? So if I look at my career specifically, I'm still pretty new in the field, especially if I look around myself. And so I've been here for the last 10 years, I think. With my focus on diabetic foot ulcer prevention, I think the biggest advance in our management has been the ability to record plantar pressures, to map plantar pressures and to actually improve the footwear based on the plantar pressures. Because people with diabetic foot disease and neuropathy cannot feel what's happening to their feet. And so if you make a pair of really good shoes for them in order to prevent foot ulcers, but patients cannot feel what's happening there, we need to measure it in order to know what we're giving to patients and in order to show it to them. And being able to reliably measure plantar pressures to show your patients that the footwear that you're giving them is reducing and redistributing the plantar pressures, that has been the biggest advance that I've seen in my career specifically. What has been your biggest challenge? The biggest challenge is the challenge we're still facing in creating awareness in people with diabetes and in all the practitioners that they're facing of the importance of footwear and the importance of adhering to wearing the footwear. And this is understandable because people have been wearing footwear for their entire life, every different type of shoes that they like. And suddenly when the disease really hits them, they can only wear the specific footwear that we're making that is preventing these foot ulcers. But that takes away choice from people. And that eats into their experiences. So the biggest challenge is to get your patient on board with the importance of wearing the footwear in order to prevent the foot ulcers, wearing it outside, but also wearing it inside their homes. And that's a challenge we continuously face every day, but we're getting better and better, I think, in creating awareness with patients, with the other health practitioners, in telling them how important it is, and in facilitating them to wear their footwear more often. Would I choose the same career again? I definitely think so. Diabetic foot disease is such a multidisciplinary, complex problem that requires input from so many perspectives. And I've been so fortunate and lucky in my career to work with so many different people all over the world and people from different perspectives. And that really enriches my life. Learning from internists, learning from surgeons, learning from shoe technicians, learning from podiatrists, learning from so many people involved in the care for these patients, and then learning from the patients themselves who have a multi-organ disease and have so many problems. And I feel very fortunate that I can bring a small piece to hopefully some of the solutions. And what makes you happy? What makes me happy in my work is if we manage to create good footwear for a patient that makes that patient happy. We create the footwear, it reduces the pressure, but it also meets the patient's expectations, that looks like they want it, and that they actually are really proud on wearing it. And we see that every now and then in our patients, and we hopefully see that more and more often. And that makes me really happy to see that patients walk away with footwear that fits their needs, that fits their personal preferences, but it's also really good for them. And that allows them to be more active and more healthy. And in conclusion, I again would like to congratulate D-Food International on pulling this off. And I think it's really important that we create more awareness all together. We're in this together, and we can fix this together. Thank you very much.
I'd like to thank Norina for getting some talks together and sending it to us. And next we will listen to somebody from Russia. Dr. Irina has been working very closely in the field of diabetic foot. So we have Irina Gurieva from Moscow. So can we hear a recorded message from her?
Hi, I'm Irina Gurieva. I'm an endocrinologist working at the Federal Rehabilitation Center for Disabilities, Chief Endocrinology Sector and Professor of Endocrinology for their Institute of Advanced Medical Studies for Continuous Medical Education for Russia. Well, about awareness on the impact on the diabetic foot disease on health services and our patients. What I would like to say, that I am in the field of diabetic foot care since the beginning. I'm a founding member of Diabetic Foot Study Group and working and particularly on the organizing of diabetic foot care in Russia since 1990. And of course, in comparison with those times of the beginning, of course, it's a tremendous increase of awareness. But it's very different in central large urbanist areas like Moscow, St. Petersburg, Vladivostok, Yekaterinburg, and the other big cities. And of course, it's quite low and not enough in the rural regions because Russia is a huge country. And of course, we work a lot on that, in particularly to motivate patients, of course, and doctors, of course, to do the professional job with knowledge of what is that diabetic foot, what is that diabetic foot risk factor, and of course we would like to fire up this awareness in health authorities and mass media and all absolutely other cultural, sport affairs and scientific field for everybody in Russia. Of course, it's not enough. Never it should be enough. Well, what about my biggest advance in the management of diabetic foot in my career? I'm lucky because since the beginning I'm working on the base of multidisciplinary rehabilitation clinic with shoulder to shoulder with orthopedic doctors, with shoemakers and technicians. And I think it's most advanced for me because we can help very difficult patients to fix the deformation and to stabilize the deformation and to cure neuro-osteoarthropathy. It's much easier for me because it's on my particularly center, their locations. So I'm very lucky that we are close to them. What is my biggest challenge? Since the beginning, my biggest challenge is of course, to persuade everybody to fulfill their duties properly. So the patients have to examine the feet properly. The doctors has to do their prevention properly, therapeutics, endocrinologists, neurologists, etc. And of course, in the difficult cases, it should be multidisciplinary team, and we have to work together. But I think the biggest challenge for me is to persuade the politicians and the healthcare specialists and the whole system to work and to collaborate together. I think it's my biggest challenge. Would me choose the same career again? It's difficult to say. I have started 30 years ago. And of course, 30 years ago, I was 30 years younger. And it was my future. It was a challenge. It was difficult to say how it should be covered, all those problems. But nowadays I saw the road, and of course we don't choose the road. The roads choose us. And if nowadays these roads again was offered to me, I think that might be I will start at a little bit earlier road. I would like to choose the prevention road. I would love to choose the earliest screening of risk factors, in particularly like neuropathy, because I believe that early neuropathic changes, both autonomic and sensory motor, are the key player in these disastrous complications. And finally, what makes me happy? As everybody of those who are working on the diabetic foot field, I think we're happy when ulcer healed. We're happy to see the eyes of our patients who trust us. And of course, I am a teacher, I'm a professor, and do a lot of education. And of course, when I can see the eyes of my students with surprise, who motivated, and of course who don't even get knowledge but start doing something, I think that that's the most happiness for me. Thank you very much.
I would like to also thank Ildiko, who got all these talks from Norina and passed it on to us, to my administrative team. And now what we'll do in the interest of time is to take some questions, some panel discussion. I would request the panelists to switch on their camera, and also if there are any questions from the delegates to the attendees, you can send it in the chat box or in the Q&A box, and we'll try to answer them. So, Dr. Abbas, we'll start the discussion. Dr. Roberto?
Yes, I'm here. Okay.
Yeah, right. So, DFoot International truly represents the global scenario. We have members from all the regions, 7 regions of the world, and our headquarters is in Belgium. Now, we would be having a program on November 14th that I'll show you at the end, which is a global program. Now, Roberto, would you, you've been regional chair for quite some time, so how do you see DFoot disseminating knowledge? And our mission statement is ending avoidable lower limb amputations, ending avoidable lower limb amputations due to diabetes globally. That's our mission. So how do you think that Europe is a developed country compared to many other developed continent, compared to many other parts of the world? So how do you think Europe can contribute to our mission, DFOOT mission of ending avoidable lower limb amputations due to diabetes globally. How do you think that Europe can contribute?
I think the story of diabetes foot in this year was in Europe for a different organization, DFOOT, not only DFOOT International, but I don't know, Diabetic Foot Study Group of ASD. So a surgery organization of diabetic foot, a podiatric organization. I think that is a moment today to put together all the organization and to discuss how we can go away with the awareness of a professionist. Because sometimes we have, as I spoke some minutes ago, we have different nation with a different aim of diabetic foot for economic aspect, for organization, for a pathway. For example, multidisciplinary and multi-professional aspect are means in a different way in a different part of Europe. So we need to put all together the organization to discuss together how means this term of multidisciplinary and multi-professional aspect and to work all together, because our patients wait for us a clear way to organize is a problem, is the food problem or is a diabetes problem.
Thank you, Roberto. So we are very clear in our mission that DFOOT was created some years ago to implement the guidance, but to translate the guidance of the IWGDF to different languages. But we have taken it up as our mission in DFOOT International, that we will achieve our mission of ending avoidable lower limb amputations globally due to diabetes. So that's the purpose of this Diabetic Foot Awareness Week. So I would like to ask Dr. Abbas, who's the president-elect, what he thinks is the role of DFOOT International in sort of achieving our mission. Dr. Abbas?
Yeah, very well said that our aim is to reduce amputation, and I had also pledged that we should reduce it by 50% in next 5 years. And if you ask me, I also had a question for Roberto, but if you ask me how to go about, I would say that in our part of the region, that's Africa, sub-Saharan region, we only talk about education, education, and education. So creating more awareness to the people who are in need. And that can be done through DFOOT. That's what the arm of implementation is supposed to be. So we need to educate those people at the primary healthcare centers. And then those are the ones who are the catchment, at the area of the catchment where the patient comes to them first. So in brief, that is what I would say, that the most challenging in our part is we still lack of awareness and education. Now I would ask Roberto what you have asked me that. Roberto, thank you very much for a very nice talk. I hope you can hear me. We have a different challenges in sub-Saharan Africa. I don't know what Europe, being a chairman, you being a chair, regional chair, what Europe has got challenges at this point in time regarding diabetic foot, and how DFOOT can address this problem.
The problem if in Africa is education, 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 I think that in Europe, the problem is organization, organization, organization. Of course, also education of patients to share our the awareness of the risk of patients. But in this moment, where really pandemic have changed all our healthcare system, we need to understand how we can improve our old organization with a new situation. For example, no all patients that we saw some months ago based on the risk class, for example, of 3, 6, 1 years, and so on. Now, for 2 years, these patients, outpatient, did not look for this doctor, for this organization. So, how we can put together the what we need for a patient and what is the organization now of healthcare system. I remember that in other part of the world we speak about a high level of healthcare system in Europe. Okay, is really, but when the high level for all person, all, for example, in Italy, all diabetes patient is linked with the healthcare system. How we can put together the old way to organize a patient and to see a patient with the new situation.
Thank you, Roberto. So
Thank
we
you,
have
Roberto.
one of our board members, Dr. Mariam, and also one of our regional chairs from the North American Caribbean areas, Dr. Simone Maconi. So Simone, would you like to say something? And Mariam? You're muted, Mariam.
Thank you, Vijay. Certainly a deep thought, listening to the vision and the mission that you and Abbas are leading. We see ourselves as an organization working at the global level to do the knowledge mobilization and translation of the guidelines. So really moving the knowledge into action throughout all the 7 networks that have been established, and together share a lot of opportunities and share common barriers and work together on solutions. So it's a wonderful vision, and the network of the 7 regions, we are a strong network and a strong community of practice where we share a lot of the work and continue to advance this space and area together. And I turn it over to my colleague, Simone.
Hi, everyone. Sorry, I have a, right, that should be better. So wonderful talk from you, Roberto, and it's wonderful to be here. We know, Roberto, we all go back pretty long with this fighting the mission for diabetic foot. And, you know, I think the one thing that I wanted to ask you was, I noticed in the North American and Caribbean region, one of the assets is improving on building a huge tight team of multidisciplinary army, I would say, an army for with the skill sets. Do you find, or do you see that being possible in your European environment? Because I know the training for the diabetic, like we focused on the mission of Diabetic Foot Awareness Week, but my thing is we need to have the skill set and we need to have the multidisciplinary training and teams. So do you, Roberto, see there being an advancing of that? Like, do you see over the years, because, you know, we've been in this for a long time. Europe is great at doing some studies and so forth, but what about bringing more soldiers to the army? Like, is there room for that? Is my question to you, Roberto.
Yes, it's a very interesting question. The situation is quite difficult because, as you know, when we published a paper of amputation, we see that in Europe we have the less level of amputation in comparison with the other countries. For example, in Italy, we have a whole way to work in team, okay? Is our approach, our life every day in our hospital, in our outpatients. And when a person, generally, for example, in Italy, when a person have a problem of the foot or have a risk, a general practitioner call us or call a nurses or our podiatrist or podologist of our team, and we discuss, we are looking for this problem. Okay, here is a whole situation of us. I think that in Europe, one thing is a whole Europe, other thing is a Eastern Europe. As you know, that in this moment, there is a difference in the two Europe, a whole Europe and the new Europe for implementation of guideline, for approach to take care patients, and how are the resources to diabetes in general and the diabetes foot in particular. So I think that we need to rediscuss this new discussion of our European team on how to implement guideline in every country of Europe. We translate a guideline. We brought a guideline. We are a part of a broader guideline. The problem is now how we translate this book, this guideline in the daily activity, in the daily organization.
Thank you. Yeah, Robert. Yeah, go ahead, Sima.
No, I was just going to comment and say, what about policies, like government policies? Is that a way of where it's part of how people are trained? Is that possible?
Sorry, I don't understand.
So you talk about translating the guidelines into being a daily practice, but is there a way then of dealing with it through the politics, through the policies of the government, through the ministries of health, to have those programs in place for training, for more podology, for more podiatrists, more, you know, of the skill set that then helps to put it in place, is my question.
In Italy, in Europe, we are different nation and the different healthcare system. Okay. In the last meeting last years, we discussed about the link between the foot or organization of the foot and stakeholders, a government, a European government. But also in this aspect, we have a declaration of European government on diabetes complication and diabetes foot. We have not a problem of money, of resources. we have a problem in how these resources link a bit with what we wrote, what is written in our guideline. In many team, we have a whole team is near the hospital generally. We have podologists or podiatrists, we have nurses, we have general practitioner, we have specialists, surgeon, vascular surgeon, and orthopedics, and so on. The problem is how today to improve the problem of diabetes food when the healthcare system is had a tsunami as a COVID. This is the problem. Otherwise, all our guidelines remain a paper. I think that now I feel that now this is the problem.
Right. Okay. Okay.
Thank
So
you.
COVID has been an issue. Thank you, Roberto.
Thank you, Roberto. I think we have a question in the chat box, I mean, a comment from Ramaz, who says that when we talk about Europe, you should remember that it goes far beyond EU borders. And she's probably talking about the East European nations. So that is why the DFOOT completely realized that there are many countries which have not come into the fold of DFOOT. So what we're doing is the first step. The new board took over only 4 months ago, and we have a tenure of 2 years. So as a first step, what we're doing is to increase the number of regional council members. We have the board, then we have the regional council members. So we are expanding our regional council members across the globe and include more and more national representatives from countries where DFOOT does not exist, and also include many more regional council members who will initiate more countries to have national representatives in the DFOOT. So once the DFOOT grows from strength to strength, then we can work along with IWGDF. We have a collaboration with the International Association of Diabetic Foot Surgeons. We are going to join hands with almost every organization across the globe in the months and years to come. And we will impart knowledge. We have in DFOOT several experts from the developed and developing world. So we will share our experience with everybody globally, East European countries, Western Pacific region, MENA region, everywhere. So this is what exactly DFOOT is aiming for in the next few months. First, expand the regional council members. And secondly, have more national representatives. And also expand to more countries and include more and more of national representatives. So with this in mind, we have a program from the Middle East and North Africa region tomorrow. We have a presentation from the Western Pacific area day after tomorrow. And the day after that, we have from Southeast Asia. So I would request my team to project the flyer for the MENA region. Can you show the flyer for the MENA region? So this is the MENA region, Middle East and North Africa region, which is going to take place tomorrow. And we have people from Kuwait, Bahrain, Lebanon, and all the countries, Syria, Egypt, and so on. And can you show the Western Pacific? We have the program from the Western Pacific region day after tomorrow. Can you just show that flyer? We have experts from Australia, China, Indonesia, Malaysia, Myanmar, New Zealand, Singapore, Taiwan, Thailand, Philippines, Vietnam. So we have the entire gamut of Western Pacific region. From Southeast Asia, we have from India, of Sri Lanka and Bangladesh. And finally, on November 14th, can you show the November 14th program? On November 14th, I would like to invite all of you to register. And we have Professor Nicholas Schapper, who's the chair of the IWGDF from Netherlands, giving a talk on IWGDF guidelines. We have Professor David Armstrong talking about new technologies in diabetic foot. And I'll be giving a short talk on the contribution of the developing world in the field of diabetic foot. Then we have a presentation by our sponsor, Ugo Medical. Then we have a very good talk by Dr. Venu Kavartapu, who is the president of the International Association of Diabetic Foot Surgeons on Charcot foot surgery. And then we have a very good panel discussion among the board members, which is moderated by a very popular person, Douglas Queen. Then we have the launch of the info cards by Jose Luis Lazaro Martinez, who's the previous president and who's currently the honorary president of DFOOT. And then we have a presentation from some of the regions like North America and Central America, Caribbean islands, Saka region, and so on. And then the vote of thanks. So this is going to be a 1.5 to 2 hour session on 14th of November, which all of you know is the World Diabetes Day. And I'd like to invite all of you to register. The registration links are available in our www.dfoot.org website. And it's also available with all the regional chairs. So I'd like to thank all my colleagues, regional chairs, board members, and participants. I think I missed one question in the chat box from Kenya, from James. My suggestion is that as we do more research, there is a gap in advocacy whereby fewer trained healthcare can't cope with the burden of patients. More capacity building is needed. Abbas, would you like to answer this question from James from Kenya? And then we conclude the session. Abbas?
Yeah, I can hear you. James has been my student, and he had come to me and Thailand and Kenya. Yeah, that is what I already mentioned, that we need to do more train the trainer foot specialist, and we have a huge project in Tanzania, which James is talking about, is going to be held very soon, the start of the next year. We need to target all the primary healthcare centers. This is our aim. So something like that, we are also negotiating with Kenyan's Ministry of Health. I hope, James, I responded to you, and this is how you will build the capacity. Thank you, James.
Thank you, Abbas. So I would like to once again thank Dr. Roberto Ancini for coming live for this. He's the regional chair of DFOOT International from Italy. And I would like to thank Ildiko and Norina for passing on the recorded versions, recorded talks. And there's one more message. So, yeah, okay. So, this program, Oleg is from Russia, will be in the website of our website, www.d-foot.org, very soon. So you can listen to the experts from all the regions and the final days program very soon in our. Can we get the slides? Yeah, it will be there in the website. We haven't decided about giving the slides, but it will be there. The talks will be there in our website. So I'd like to thank all of you for coming live and taking part in today's session from Europe. And thank you very much. And I would encourage you to register for the MENA region, Western Pacific region SEA region, and importantly, the November 14th program, which I showed you. So thank you very much, Roberto, and thank you, everybody.
Thank you for you.
Take care. Take care.